Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Our guest in studio is returning to speak with us, Dr. Mary Wingo. Earned her Ph.D. in Human Stress Research from the University of North Texas, immigrated to Ecuador, a tiny country in South America, and while living in a new and very different society, her eyes were open to, well, the unsustainable social, economic, and political costs preventable stress causes in the modern world. Welcome to Health Professional Radio today, Dr. Wingo.
Oh, thank you, Neal. Thank you for the wonderful intro.
My pleasure. Talk about this new book. Why did you write the book?
Well, like I said, I wrote the book because I see what state that we're in, and I actually didn't want to write any book because I knew that it was really going to be a pound of flesh, and boy, it was a pound of flesh. But I wrote it because where we're coming at, where we're at right now, I figure more than ever people needed this. And I'm not talking just folks in the U.S. or in Europe. I'm talking every community around the world. It's needed. It was about time, and it was needed.
Well, the stress of, I guess, writing a book, it's not like you just woke up and decided to write this book. You've been on a journey of learning. Is that right?
Yeah, it's like a little bit of an understatement. No, seriously. I can't even begin to tell you the journey of this book. It was, what is it, the 7 rings of hell? Because, again, it covers so much. It covers like so many aspects. You get a little bit loopy when you start looking at all different aspects of the just human stress response, and it kind of makes you a little bit crazy. It's a little bit nerve wracking.
Well, we have the ability to, I guess, adapt to different situations, all types of situations and environments. Your book, is it more than just another self-help book?
Oh yeah. Well, number one, it covers the science. I mean, and we're not talking, okay, well, we get increased cortisol and increased adrenaline levels, and then, this happens and that happens and the fight or flight response. No. These are one big, I should say, choreographed response. Okay. So we're talking a bunch of mechanisms that cascade to meet an end result. And what that is, what stress is, it allows your body to temporarily, or whatever organ that is stressed, to become temporarily more plastic, so it can rearrange itself to function better in the new environment. So it's kind of like, it's a mechanism for which you become jellified until you can get your wits about you, and you can figure out what the new environment is. An example of this is altitude, adjusting to altitude. And I know this personally. When you are living, at 8,200 feet, you don't have the red blood cells. You don't have the network of capillaries for which, that absorb the O2 molecules from your alveoli. This needs to reorganize because the air is much, much thinner. And so it takes several months, if not more, to completely reorganize. And some of us never totally do it. But that's just an example, a very easy to understand example. And that's what the stress response allows us to do.
If we're battling stress every day, and some of us, we might be police officers or surgeons, you yourself, a Ph.D., battling these stressors, when do we start to abuse these mechanisms rather than just use them the way that they were meant to be used?
Well, understand that stress is supposed to be used periodically. It's supposed to be employed periodically. It's not supposed to be a grinding, even if it's small stuff. Again, you think that the sitting in traffic every day, I remember that in Dallas, I don't miss it. It makes no difference in your life. Well, doing this day after day after day after day after day for 20 years culminates into something no good ultimately. And so remember that you use it it like sort of like you would use a nitrous oxide boost on your engine. You don't use it all the time, on your turbo boost. You use it at only when you need it. Okay, and that and that is how we are meant. That is how we are constructed. Totally overusing this mechanism every day, every second of the day, is going to do nothing but just kill you young.
Now talk about the easiest ways that we can avoid some of these stressors, control some of these stressors, and improve our health.
Well, okay, like for instance, if you already, like I said before, this is extremely important. If you're already stressed, okay, really understand what a stressor looks like and do not add any more. Okay, it's very, very important, especially emotional stress, not to add any more. So if you've got a stressful job, the last thing you need is a stressful home life. Okay, so that you need peace and quiet home. For instance, that's extremely important. Go ahead.
Wasn't it Thoreau that the simple life?
As a matter of fact, Thoreau, I've got a little part in the very end of my book, which makes a reference to Thoreau. Thoreau is probably the greatest American philosopher, other than Nassim Taleb, in American history. And yes, and in fact, he has greatly influenced my thinking and probably influenced much of this book. And so, yes, simplify, simplify, simplify. I can't say this enough, especially to people who are under a tremendous amount of stress. This is the stuff that you can control. You've got to simplify.
And where can our listeners get a copy of your latest book?
They can go to my website, marywingo.com. They can get a free excerpt with a video tutorial, and they can also purchase the book from Amazon.com. And I've got lots of fun, provocative material on my website. It's going to ruffle lots of feathers.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Mary Wingo, Ph.D. and human stress expert, in studio talking about her book, The Impact of the Human Stress Response. Transcripts of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.